Lorrie Lancaster. I'm a paramedic with Tabor City Emergency Services, and today we are going to talk to you about medication administration. With me are three of my juniors, June, Kelly, and Kayla. And today we're going to talk you through some of our major medications and how to properly administrate them. First of all, our first drug of choice is what, guys?
Oxygen.
Oxygen. So as we move over here, this is our big old oxygen bottle, and you always have to crack it, make sure it works. And this patient, our little lovely airway mannequin, is having some shortness of breath. His oxygen level is 92%, complained of mild shortness of breath. So what we're gonna put him on? What's this called?
Nasal cannula.
Okay, so take your nasal cannula, take the prongs, put it in their nose, around each ear. And it's a lot harder on some of these people with the long hair because you'll tie their hair up in it. And that's as simple as you do. But please don't forget to hook it up to the O2 bottle on here. And then you turn it on to 2 liters. That's what it's saying right there, 2. How much oxygen do you on nasal cannula?
1 to 6.
What's primary drug dosage for a nasal cannula? Normal. What do you put them on?
2 to 4.
2 to 4. That's as easy as it is. Just that simple. Then you cut it back off, slide it back out. Now you put it on. Show me how to do it. Ooh, shot me.
These go down
Right. In the nose,
and around.
around the ears.
Okay.
Yeah. Yeah, the mannequin ain't got much ears, so it's a little bit harder.
And then just enough not to choke him.
Yeah.
Cut it on to 2.
Your little numbers are back here behind it. See back there? There you go. A little bit more. There you go. And it's on 2. That's all you have to do. Okay, now we're going to cut it off. Now, your patient is oxygen saturations are 90%, really shortness of breath. The nasal cannula's not helping. So we're going to bring out a bigger gun. This is called a non-rebreather. Okay? And we're going to hook it up first to the machine or to the oxygen bottle. Slide it in. How many liters are we going to put it on? 6 to 8 for a nebulizer, right? So what's this one going to be on?
8 to 10.
Okay, let's try 6 to 15, but fill up your bag. Put it on their nose, seal it, and around their head, just like that, okay? And then I'll turn it back off. That's a simple non-rebreather, okay? Well now, they're only breathing 6 times a minute. So now what do we need to go to?
Back on.
Okay, that's this big boy, right? Same thing, you hook it up, take your mask, because always remember the apex goes to the nose. You do the C and the E, sniffing position. How many liters does this go on?
15.
15. 1001, 1002, 1003, 1004, 1005, 1006, and breathe. Every time you take a breath, give it a breath. If you're doing it too fast, you're gonna hyperventilate them. You're gonna blow that stomach up, and what's gonna happen? They're gonna throw up all over everything, okay? That's as simple as a bag valve mask is, just that simple, okay? Any questions? Y'all got this?
Yes, sir.
Good job. Okay, and we'll cut that off. We're gonna set the oxygen bottle now. All right, our next drug will be Benadryl, okay? Y'all know these little pink tablets? We give this for what?
Allergic reaction.
Allergic reaction. How do you give it?
Or
Orally. What's that mean?
in the mouth.
By the mouth. How many of them?
2.
So what's the dosage?
50.
25 to 50, which will be 2, and you give it by mouth. Okay, but they didn't work. Now they're unresponsive. What's our next drug that we can give for allergic reaction?
Epi.
Epi. We use the trainers because I'm not gonna let y'all practice when I knew with somebody poked. This is our Epi 1 in 1,000 trainer. Pop the cap. Give me here. Come sit right here. Look, got to show you how to do it right. Come sit up here for me. Okay, now take it. Here's the thigh. Pop it in. Hold it for how long?
10 seconds.
10 seconds.
Unless it says
Then unless it says otherwise, pull it out and it's that easy. Okay, now what should I have done before I gave her this? What should I have asked her? What are you allergic to? What about sample? Y'all would always forget. We have to ask, is this the right patient? Is it the right drug? Is it the right dose? What about the right, okay? And of course, the right route, okay? You have to make sure that you ask these people, hey, are you allergic to epi or are you allergic, what'd you get into? Because you don't never know. So make sure you do that. How often can you give epi? You can give one dose. If it has to take another dose, then who do you call?
medical director.
Your medical director. Any doubt, you call them, right? Good job, guys. Thank you. Okay, what's our next drug? How about oral glucose? I know we have found over this little tube right here. What's the dosage?
15 minutes.
15 grams. And what do you give oral glucose for?
Sugar drop.
Okay, how low does their sugar have to be to give it to them?
69.
Okay, they're 69. It's 64. Do they have to be conscious or unconscious?
Conscious.
Okay, and where do you give it?
Sublingual.
Twist the cap off.
Orally.
Yeah, orally, and you put it on mash on the inside of the jaw. What if they can't swallow?
Glucagon.
Then you would go to glucagon. Okay, well, you push it in a little bit, let them swallow, push it in, let them swallow. Then what do you need to do after you give them the oral glucose in 15 minutes, or 10 to 15 minutes?
Research their sugar.
But check their blood sugar again, and it should be up. But if it's not, then you can go, because more than likely, if you give oral glucose and it doesn't work, the first tube, the second tube should bring it up. And if it don't, they go unresponsive, then you pull up glucagon. And that's a new drug for EMTs now, and you have to draw it up in the thing with your syringe. You pull up your 1 milligram where it says 1, and then you put, I don't have a needle, but you put your needle on, and you go into the muscle, wipe it, and slap it in, okay? But you also have to ask them the same question. Is it the right dosage, the right patient, the right route? The same question to no matter what the patient is, right?
Yes, sir.
Okay? Then, well, that didn't work. Their sugar's up, they're still not responding. They have pinpoint pupils. What is a favorite thing for Columbus County? Is overdoses. Okay? And what's our first drug of choice for an overdose? Narcan or naloxone, right? This is 2 milligram. It comes in what dosage? 0.4
to 2.
0.4 to 2. Okay? Kelly, pop and put them together. And this drug is also, you have to ask what? Right dosage. Do they know what they took? Does it work on everything? No, it only works on opioid overdoses. It just twists off, yeah. There's your little mad. Okay, come to the mannequin and show me how to push it in the nose for me.
Yes, ma'am.
Columbus Central Station 6 Fire 4
And then
response
put it right
108.
Yeah.
And then push it in.
There you go. And you mash it through. Okay, now, that didn't work. Okay, giving them that medication didn't work. So do you, I have to quit saying but that didn't work, so what can we do now? We can either give them another dose of the same, or we can do our trusty Narcan. And fire, police, even the people at home, family members, they carry this Narcan intranasal. So how much of this do you give?
0.4 to 2.
It is not. It's a 4 milligram. It's a 1-dose thing, and it pushes straight up the nostril. I'm not going to open it because, no, that's one of our new ones. But it's a Narcan 4 milligram, and it is definitely for opioid overdose. Okay, that is given for fentanyl that's passing around in the county now. It's given for heroin, and it works. They will come up fighting. They will come up mad because you took their last $5 away from them. So always protect who? Yourself. Okay? Now, what about, let's see, what's this?
Aspirin.
Okay? What do you give aspirin for?
Chest pain.
Okay? And what else? What about fever? Okay? You can give it for fever too, right? For a fever, 1,000 milligrams. Well, what's the dosage for aspirin for chest pain? You give 4 of them, right?
81.
81. You
Yes,
give
ma'am.
4 of them. But what do you need to ask them? Are you allergic to anything? Make sure you ask, no matter what your drug is, you check this. Yes, it's aspirin. Yes, it's 81 milligram. The expiration date, 9/26. You have to make sure you're checking your medication and document the time that you give this medication. Because when the doctor says, well, what time do they have this? And if it's not worked, then they know what to give more of. The medication, little old pink chewables, right?
Yes, ma'am.
And you said how many of these?
4.
4 of them, that's right. Good job, girls. Thank you, appreciate that. Okay, and that's the same thing with Motrin. Motrin is an NSAID, and you have to make sure when you give Motrin that you don't give it to patients that are GI bleeds, liver disease. You can't give them that because that's a contraindication. What's a contraindication? Something they don't need, just like if they're allergic to it, okay?
Yes, ma'am.
Down. Here's the love of the choice right here. This, let me put the lid back on. What's this little brown bottle?
Nitro.
Nitro. And what do we give it for?
Chest pain.
Chest pain. Okay, how do we give this?
Sublingual.
Sublingual. You take one with gloved hands, and they little bitty. I don't know, can you see this little bitty pill? See how little it is?
Yes, ma'am.
Well, I put my fingers on it and I know I shouldn't, but it's expired, so maybe it won't hurt me. You put it in the cap, you take the patient's hand, or you drop it up under their tongue. They'll want to put it on top, they want to put it on the side, but you have to make sure it goes up under the tongue. And for a nitroglycerin for us as EMTs to give them, what's some of the things that we have to ask the patient?
If it's prescribed.
If it's prescribed to them, what else? Okay, these little hefty men. You know, there's one thing we have to ask our lovely men. Have you taken what? And I don't care if the women's around them, kind of ask them quietly because, you know, they don't want the women knowing what they be doing. So just, you know, be discreet. But nowadays you have to ask the women also. Okay? What's another thing you have to do with nitroglycerin?
Make sure their systolic temperature is above 100.
That's right. That's a good job. And you can give that every how many minutes? Every 5 minutes, right? Give it every 5 minutes until they're pain-free, or at least, you know, the blood pressure's coming down and the pain level's coming down. Now, we went over all different kinds of medications. Do y'all have any questions?
No, ma'am. No, ma'am.
Any questions? Y'all done really well. Now remember, we're gonna recap. Oxygen is your first drug of choice. You can use a nasal cannula, a non-rebreather, a bag valve mask, or a nebulizer, which we don't have a nebulizer up here, but that's what you can give. Benadryl is given for,
Allergic reaction.
and you can give it by mouth. You can give it by IV or IM, that's for intermediate level. The EpiTrainers, which we usually train with, but the EpiPen can be given by EMTs. You can give it IM or IV or IO by intermediate or paramedic. Or glucose is for EMT, anybody. People on the street can give oral glucose. The Glucagon, an EMT can give now. Narcan, this is everybody. This is a household thing now because a lot of the doctors, when they prescribe pain medications to patients, they also give them Narcan, because even the elderly make a mistake. I didn't say they were overdosing, but even the elderly make mistakes with their pain medicine, and they give it, so they give out Narcan. And that's the nasal, and then this is the one that we give through the,
Night device.
yeah, the MAD device, or IMIO IV. Aspirin is given by mouth, that's right, so is Motrin. And then, of course, your last one, your nitroglycerin, is given under the tongue. So, you guys have any questions? Okay, thank you guys. We're through with medication administration. Just want to say thank you, and thank you for my 3 lovely ladies that helped me through this video. Bye.